All right. Good morning, everyone. Today we are reporting 1,091 new confirmed cases and 296 new probable cases. Of all of those, we have 95 new hospitalizations we're reporting, as well as 30 new deaths. Those deaths have occurred, one in Bonham County, one in Brookings, one in Butte, one in Coddington, one in Custer, 2 in Davison, 2 in Gregory, 1 in Hughes, 2 in Kingsbury, 4 in Lawrence, 2 in Lincoln, 1 in Lyman, 4 in Minnehaha, 4 in Oglala Lakota, 1 in Pennington, 1 in Turner, and 1 in Union County. We also have 741 newly recovered individuals who are no longer able to transmit the COVID-19 virus. We have 6,717 new tests that have been reported to the South Dakota Department of Health. This does bring our case totals to 64,582 total confirmed cases and 4,089 total probable cases. Of those, we still have 19,240 individuals with active infections, but a total of 48,757 have recovered. We currently have in the hospital 593 individuals, and we have a total of 674 deaths. This does bring our total testing numbers for the state to 537,485 total tests reported among 300,973 unique persons. I did also want to provide an update that we are pushed to the dashboard that you should see. So the first of those updates is that the main tab now includes the RT-PCR test positivity rate for the last full day for which we have results. So this would be for today's update. The test positivity rate would be for Monday, November 16th. This is also the same data that is found on the Trends tab, and just want to make sure that folks are able to see and use that test positivity rate data. There is a reminder that we also have some other weekly percent RT-PCR test positivity data on the dashboard, specifically that main dashboard page where we show the community spread map. That map uses a weekly RT-PCR test positivity data from the past calendar week, Sunday through Saturday. So please just recognize that there is a difference in between that weekly test positivity rate data and the one-day positivity rate data that we post on the website. The second major update we have for our dashboards includes adding some hospital capacity additional information to the hospital capacity tab. So due to some increasing interest and our transparency around adult ICU beds and incorporating some of the prior changes to the HHS teletracking related to data collection, we are now showing ICU beds as first category as adult ICU bed capacity. So this includes those breakdowns for COVID occupied, non-COVID occupied, and available adult ICU beds. The second breakdown is the adult and pediatric ICU bed capacity, and that includes 2 levels, occupied ICU beds and available ICU beds. HHS teletracking does not include reports of COVID-occupied neonatal or pediatric ICU beds as they did previously, and that's why that it will look a little bit different. And then the third piece is that the changes that I just mentioned are also reflected throughout the tables by region and by hospital. So please take a look at those updates to the dashboard. The last piece of update that I have for you is just looking at our total cases, hospitalizations, and deaths. And so we have not seen over the past month a large shift in the percentage of our population has developed COVID-19 infection. We still have our highest percentage of cases occurring among those aged 20 to 29 years. For the percentage of COVID-19 cases that are hospitalized, that percentage of hospitalized increases with age. The hospitalizations are lowest among those aged 10 to 19 years at 0.8%, and highest among those who are 80 years of age and older at 25.3%. Our older adults, those 60 and older, make up 21% of cases, but account for 62% of hospitalizations. And children and young adults under the age of 30 make up about 34% of cases, but only 7% of hospitalizations. The last piece around this is looking at the percentage of COVID-19 cases that do die. And those individuals, there's an increasing risk of death with increasing age. We have had no deaths reported among children from the age groups birth to 9 years and 10 to 19 years. But we do see the highest rate of death among cases aged 80 years of age and older. About 12.7% of that population will die with COVID-19. Of the total deaths that we've seen in the state from COVID-19, 89% of those occurred in older adults, aged 60 years and older. And that means that about 1 in 8 adults aged 80 years and older who tested positive for COVID-19 have died. So with that, I will turn it over to Secretary Malcolm-Risden.
Just a couple of quick updates, folks, on some of the testing initiatives that we have going. So last week we talked about some of the community mass testing that is available. We have had a great response to that so far. We've seen over 3,800 people come through the mass testing in Pierre, Mobridge, Aberdeen, Oklahoma, Watertown, and then the first day of both Yankton and Madison. And so far we're seeing results from that show about a 9.8% of those folks coming through those mass testing being positive. Of those 9.8% that test positive, 34% of those individuals have been symptomatic. The other update in that regard is that we have been able to add several dates for Rapid City. And so please help us get the word out so that people can take advantage of that. We'll be in Rapid City on November 20th, November 21st, November 22nd, and November 23rd. And so, again, this is a partnership between the Department of Health, the Federal Department of Health and Human Services, and then the South Dakota National Guard. And by all accounts, the National Guard is just doing an amazing job of getting people through the tests. It's easy, it's convenient, and it's fast. And so we really want to see people take advantage of that. The other update that I have for you in the realm of testing is that this week we will be starting to offer home-based saliva tests for COVID to household contacts, close contacts of positive cases. And so we are optimistic that this will be a good testing option for people. The way that this works is that if there is a household close contact of a positive case that wants to take part in testing, we will give them a unique code to redeem on a website with our partner for this, which is called Vault Health. They will order their test. Vault Health will send them a test in overnight mail. The person will then click onto the Vault Health site for a Zoom meeting for that specimen collection instruction and observation. They will then mail their specimen back to Vault Health and get results in 24 hours. And so we think this is going to be a good option. We know that the risk of spread of COVID increases when you're around people, especially in household-type settings where it might be more difficult to mask or you're otherwise having extended contact with individuals. And so we will be reporting out on this and be sure to update you on how this goes, and we hope people will choose to take advantage of that as well. again, testing is really important so that we can identify people that do have COVID and make sure that they isolate and try to slow that spread. So,
with that, we are now going to open up the phone lines.
Yeah, JP from KORN News Radio.
Go ahead, JP.
Yeah, so what criteria do you use in selecting locations for mass testing?
So that's a great question, JP. Thank you. So we looked at locations across the state where we are seeing increasing cases and either decreasing or stable level of testing able to be supported in those communities. And so it was kind of a combination of both of those factors. So far I think the numbers are bearing out. We've seen good response across the board.
Okay. Next question, please.
This is Jonathan.
This is Stephen Gross from the AP.
I heard the AP.
Yeah, so I was wondering, I know there's 30 new deaths that were reported today after a couple of days where we had like 1 and 0 deaths. I was wondering if there's a reason that it seems like we have days with fairly large death report numbers and then days where it's really low.
Stephen, this is Secretary Melissa Rising, and I'll ask Dr. Clayton to weigh in as well, but just to kind of reiterate, when we report deaths when they are certified by a medical provider and provided through our vital record system. And so there is a time frame between when the event occurs, and they have up to 5 days to actually certify that death. And so you can see, some timing differences from that process, which we obviously use to have the official data.
Mm-hmm. And then when it comes to the data that we receive, so the collaboration that we have with Vital Records is that we receive a report once a day of all of the deaths that have occurred, and then we work to go through and make sure that those deaths are accurately reflected in our case numbers. As soon as we receive that, we're starting to work and get those updates reflected in the data. It does depend on when we're receiving the file as to whether the cases get included, or whether those deaths get included in the which day's numbers. And so just again, the recognition that the data that we push out on the website daily is cut as of 1 p.m. And that is our standard way of reporting since the beginning of the pandemic, and we go with what we have and we update that if we have additional information.
Okay, I believe the next question is from Jordan or
Jonathan.
Sorry.
Yeah, that's okay. That's okay. Hey, clarification, Secretary. You said 34% of the mass testing were symptomatic or asymptomatic, and then secondly, I question about, as of yesterday, the fatalities of this. 43% of the people who died of this had actually never even been hospitalized, according to your data. Can you explain what the circumstances are in that?
I just need to clarify that on the first part of your question, Jonathan, is 34% of the people that came through the testing had symptoms, so they were symptomatic.
Okay. Gotcha.
Thank you for asking that. And could you repeat your second question, and Dr. Clayton can answer?
Yeah, just that as of yesterday, in terms of the fatalities, 43% of those had never been in a hospital setting, according to your data. And I'm just kind of curious, what's going on there? Is there one overriding factor in explaining that?
Not a specific factor, that we're aware of. Obviously, with the age of the decedents, some of those are occurring in long-term care facilities, so they are in receipt of that long-term care as opposed to acute care setting. But yeah, I'm not sure that I can really comment beyond just saying that, when we include kind of those that are in the long-term care, that number is pretty small overall that did not necessarily receive any care.
Okay. Next question, please.
Todd Epp, Kello.com News.
Go ahead, Todd.
Thank you. I'm not sure if this is for the Secretary or Dr. Clayton, but remembering way back in March and April when the projections were we would have the surge in May or June, and the National Guard was called in to see if, how they would maybe put up field hospitals to care for the surge. Are we close to that now? It sounds like the hospitals are almost at their limit on ICU beds. And what would be the tripwire to have the National Guard go in and try to supplement those hospital beds?
Todd, this is Secretary Melson Rice, and I'll start. Obviously, hospitalizations have been a key factor that we've been watching and preparing for. We have very routine conversations and dialogue with the hospitals in our state to understand what they're seeing and what they're experiencing and kind of how they're changing their operations to deal with the patients that are coming to them. And so I can tell you that, the three major hospitals, the larger hospitals in the state, are all doing, providing care to folks that need it. They have not turned anybody away that has needed care for because of COVID. They're making changes to their operations, and so that might be anything from, maybe they have a nurse that works in an administrative role, but they're asking, that kind of workforce to help pick up shifts to care for patients. It means everything from turning one area of a facility that is typically used for one type of care into care that can be provided to folks that have COVID and making sure that the physical surroundings are set up to be able to do that. So there's quite a bit of things that are happening within our hospitals to be able to handle the load at this point. I know staffing remains one of those, one of the concerns, and, needing to just help make sure that our workforce is healthy, that they stay safe, and that they are able to provide that care. So that's, of course, top of mind as well. To your question of are we close to needing field hospitals, I think what's, there's not necessarily a number or a tripwire per se, but the fact is that, we are still in a position where we're seeing hospitals able to provide non-COVID care, and I would expect to see that look very different before you start branching out into kind of the field hospital concept. I would think we would see changes, more changes in the hospital care that is being provided today before we start to see field hospitals.
Okay.
Great, thank you.
You're welcome.
Next question, please.
Ray from Kellerland.
Go ahead, Ray.
Hi, yeah. The DOH has repeatedly shared messages about hand washing, physically social distancing, wearing masks when you can't social distance and stressing CDC guidelines. Yet the recent public service announcements from the governor don't mention masks or CDC guidelines. How does that happen?
Well, Ray, there's a development process that goes into any communications, and I believe, just dealing with the time of a PSA, you've got to pick the messaging that you're going to be using and emphasizing. And again, we work for Governor Noem, and we have had support to continue to provide the CDC guidelines, whether that's about masks or tests or hygiene or other mitigation matters.
Okay. Next question, please.
If no one has one, can I follow up?
Yes.
Okay. You mentioned under the leadership of the governor, but I'm still curious. It would seem that there's not conflicting messages, but there's a key piece that you guys have stressed repeatedly since the pandemic that's left out of her PSAs. Do you have any concerns about that? I guess I know there's timing, but help us understand that more.
Well, Ray, I would direct you to the governor's office staff if you have specific questions about that PSA. What I can tell you is that Governor Noem supports her health department in implementing the CDC-based guidance around COVID, and as you know, that's changed over time. Our understanding of the disease has changed over time, and, there are a variety of mitigation strategies that we need people across the state doing, especially as the weather turns colder now and we see more people doing things indoors. You know, we've got the holidays coming up. That's a time that we all want to spend with friends and family, and so really asking people to be thoughtful and planful about those kinds of things so that they can have a safe time with family and friends, and that we don't see more unnecessary spread of COVID through any gatherings for the holidays.
Okay. Can we have time for one more question. We have the last question.
Abby Wargo with the Capital Journal.
Go ahead, Abby.
Recently, North Dakota and Iowa both implemented mask mandates. Do you have any, and obviously there are neighboring states, so do you have any thoughts on more mask mandates in the Midwest, and do you foresee any of that happening in South Dakota? And what do you think it would take?
So, Abby, Governor Nome has been very clear that she does not support a statewide mask mandate, and so not anticipate that being something here in the future. And so, you know, again, we want people to have the best information possible to take the action that they need to take. As the surgeon stated here last week, it shouldn't take a mandate for people to do what they need to do. It's information and it's action, and we think people have the ability to take that action right now.
Okay. We would like to thank you all for joining us for our media briefing.